We have consistently informed you that the virus is now firmly established in our communities. This reality is supported by the numbers we record every day. Let's take a reflection on the data that we have gathered so far. 3,106 out of the 3,457 confirmed cases are local transmissions. This means that local transmissions from this cumulative number account for 89% of the cases. If we look at the counties, in terms of the number of confirmed cases, cumulatively, Nairobi leads with 1,546, accounting for 44.7% of the total number of confirmed cases. Mombasa follows with 1,020, approximately 30% of the total cases. And we are now seeing Busia move on up to third place with 308 cases, or approximately 9% of the total cases. We have other counties that follow, Kajiado at about 3% of the cases. And we're also seeing increasingly more and more of our counties joining the ranks of those counties with confirmed cases. As of today, we have 38 out of the 47 counties have reported COVID-19 cases. This, you can see, is only a matter of time before all the counties report positive cases. Of course, this is a worrying trend that requires serious interventions at all levels. In fact, you can see that the community transmission is now moving out of the metropolitan areas, urban and peri-urban areas, and is moving into the counties. Hence the need for the country to respond to this pandemic as one. That means the national government and the devolved units need to work together in order to control this pandemic. As a ministry, we have worked and will continue to work very closely with county governments to upscale the level of preparedness at the county levels. Indeed, a lot of work has been done to upscale the county level preparedness. Most of the counties now have dedicated isolation and treatment centers for COVID-19. This is important because it creates room for other non-COVID-19 cases to be managed in separate facilities. I want to thank the counties, the county governments for this achievement, and to appeal to them to do even more as we anticipate an upsurge of infections in the coming days. Turning to COVID-19 statistics, I want to report to you that over the last 24 hours, we ran a large pool of tests, 3,503 samples, of which 152 samples tested positive for the virus. The cumulative number of tests that we have conducted so far is at 112,171, and the total caseload or confirmed positives in the country is 3,457. All the positive cases, 152 positive cases, are Kenyans. 116 of these are males, 36 are females. The youngest is 2 years old, and the oldest is 65 years old. Nairobi accounts for 70 cases out of this 152. Mombasa, 41 cases, Busia, 16, Kiambu, 9, Kajiado, 4, Machakos and Migori 3 cases each, Kisumu 2, while Taita Taveta, Narok, Nakuru, and Uasin Gishu have 1 case each. If we go down to the sub-counties in each of these counties, begin with Nairobi with its 70 cases. They come from Embakasi, 21, Starehe 9, Makadara and Kampunji 6 each, Kibra 5, Mathare 4, Dagoretti North and Embakasi West 3 cases each, Embakasi East, Roysambu, Langata, Kasarani and Westlands 2 cases each, Dagoretti South, Embakasi Central and Embakasi North 1 case each. The county of Mombasa had 41 cases, which come from Nyali 14, Mvita 10, Likoni 7, Kisauni 6, and Changamwe 4. Busia, the 16 cases in Busia are all of truck drivers from Malaba point of entry. In Kiambu, the 9 cases are from Ruiru 6, Thika 2, and Kikuyu 1. Kajiado recorded 4 cases coming from Kajiado Central and Loitoktok, 2 cases in each of these areas. In Machakos, the 3 cases are from Athi River, 2, and Moala, 1. While in Migori, the 3 cases are from Suna West, 2, and Suna East, 1. In Kisumu, the cases are from Kisumu Central, 1, and Kisumu East 1, while in Uasin Gishu the 1 case is from a truck driver at Tarbo. We mentioned 1 case in Narok, and it is from Narok East. In Nakuru, the 1 case is from Nakuru West, and the 1 case from Taita Taveta is from Voi. We're happy to report that we have also discharged 57 patients from various hospitals, bringing the total number of recoveries to 1,221. Unfortunately, we have also lost 4 more patients to the disease, bringing the total number of case fatalities to 100. To us, every death is a tragedy, and our thoughts and prayers are with the families and friends that have lost their loved ones. The numbers of infections and those that have succumbed to the disease point to the importance of observing the containment measures. This is the surest way of ensuring that we limit these numbers and contain the spread of the virus. Finally, I want to reiterate the issue of cross-border truck drivers. As you've all witnessed, we have seen snarl-ups at our border points, particularly the border points with Uganda, Busia and Malaba. And to a large extent, these snarl-ups are caused by truck drivers not following the directives that have been issued in terms of not embarking on their journey before they have a COVID-19 free certificate in their possession. We want to appeal to drivers and their employers and those loading cargoes onto the trucks that these drivers are driving, that these trucks should not hit the road until the driver and the crew of those trucks are in possession of COVID-19 free certificates. There are a number of centers that have been outlined in the guidelines where truck drivers can be tested and obtain their results and certificates from before they embark on their journeys. We appeal again that we observe these procedures so that we do not create this traffic snarl-up. I want to appeal to all truck drivers to strictly adhere to the protocols already issued. For the avoidance of doubt, let me restate that we have said many times before. All cross-border truck drivers must ensure they get tested 48 hours before they commence their journey and acquire a COVID-19 free certificate. This is to ease processing at the border points and to ensure that there is no congestion. Once again, we urge all truck drivers and owners of trucks to familiarize themselves with the protocols which are available on the ministry's website. Before I wind up, I want to comment on a question that came up yesterday during the briefing which happened at KICC. And the question was with respect to the opening hours of restaurants and eateries now that the curfew time has been moved up from 7 to 9. I think our response was that there were instructions that would follow as to the opening time for restaurants. This was under discussion at that time. We anticipated that because the curfew has been pushed up, naturally the hours of operation of restaurants and eateries would equally be pushed up. For now, the closing hours for restaurants and eateries is 5 p.m. We want to correct that, it's 5 p.m. However, this is under discussion, and as soon as decisions are made as to when the cutoff time is, it will be communicated at that time.
We are urging that if you walk into a shop or a supermarket or a restaurant and whoever is serving you is not wearing a mask, remind him or her that he or she is a risk to you. Remind him or her to wear his or her mask to protect yourself. On the other hand, if you are the vendor at the supermarket or the shop, or the restaurant, or the mama mboga, and whoever is coming to you does not have a mask, remind him or her to protect you, to wear the mask. So, dear Kenyans, if you are to go by what the rest of the country is experiencing, South America, for example, I don't want to scare anyone, but if the mask is going to help us not get there, this is the time that each of us takes individual responsibility. I protect you and you protect me.